Welcome to Pharm Mini number 13, Antibiotics. Antibiotics are used to treat bacterial infections, either by killing or controlling bacteria growth without killing any of the host cells. Because this does kill certain bacteria, it may disrupt normal flora, which can then lead to superinfection. If antibiotics are overused, they can lead to bacterial conjugation and antibiotic resistance, and that's the bacteria growing and evolving to resist the medications that are used. We can categorize antibiotics in two ways. We can categorize them as broad spectrum versus narrow spectrum. Broad spectrum will treat any variety of antibiotics, where narrow spectrum is created to treat certain bacterial infections. Then we have bactericidal, which kills bacteria, versus bacteriostatic, which just reduces their ability to grow. So the mechanism of action in antibiotics is to destroy bacterial cell walls. It can do this by inhibiting enzyme conversion that's needed for that bacterial survival. It can impair protein synthesis of bacterial ribosomes, and it can disrupt bacterial synthesis of DNA to RNA. Remember, the RNA can then produce proteins, which causes a lot of the effects in the body. So if we're stopping the synthesis from DNA to RNA, we're preventing those proteins from being made. When choosing the appropriate antibiotic, we'll generally start with a broad spectrum and do culture and sensitivities. So if they have a wound infection, we would need to get a wound culture. If they have suspected blood infection, we would have to draw the blood. But somehow we're going to try and identify what infectious bacteria is causing infection. And then once we have identified that, we can move from the broad spectrum antibiotic to a narrow spectrum antibiotic. We can do combination therapy, which means providing them with multiple antibiotics at a time. Sometimes it will be a broad spectrum plus a narrow spectrum, or it may be more specific. We would also need to decide if the antibiotic is used prophylactically, such as prior to surgery, or if it is used for treatment of an actual infection. Then lastly, we consider host factors, such as what's the status of their immune function? What is the site of infection? What is their age? Are they pregnant? And have they had any previous allergies to any antibiotics? So there's two categories of antibiotics: antibiotics that alter cell walls and antibiotics that inhibit protein synthesis. So for antibiotics that alter cell walls, we have our penicillins. So penicillin, amoxicillin, ampicillin, and piperacillin tazobactam. So you'll notice the penicillins all kind of end in -icillin. Then we have our cephalosporins, such as cephalexin, cefazolin, ceftriaxone, and cefepime. And you'll notice that a lot of these start with ceph. Then we have our carbamenopins, such as meropenem. We have vancomycin, aztreonam, and fosamycin. As far as indications go, these mostly attack bacterial-based infections and meningitis that are caused by gram-positive cocci, gram-negative cocci, and sporochetes. As far as the mechanism of action goes, the name kind of indicates it, but they weaken bacterial cell walls so that the cells cannot reproduce or survive. It can be administered IM, PO, or IV. The side effects of antibiotics that alter cell walls include, with penicillins, it can cause renal impairment, diarrhea, hyperkalemia, and hypernatremia. The more adverse effects of penicillins would be dysrhythmias and anaphylaxis. The side effects of cephalosporins include bleeding, renal impairment, pain, and diarrhea, with the more severe reactions being anaphylactic allergy, thrombophlebitis, and colitis. Carbapenems can cause GI dysfunction, thrush, a black furry growth on the tongue, vaginal yeast infection, and more adversely, allergies and colitis. And then vancomycin can cause ototoxicity, anaphylaxis, renal toxicity, and thrombophlebitis. As far as interactions and contraindications go, if anyone has had an allergy to an antibiotic, they should not have that antibiotic or any antibiotics within that class. Penicillins can inactivate contraceptives, so we would want to educate the patient to take another form of birth control if necessary. Cephalosporins interact with alcohol and calcium, and they can cause renal impairment, so we would want to avoid that with anyone that does have renal impairment. And then our carbapenems interact with Depakote and are also contraindicated in pregnancy. As far as specific education goes, if someone's taking a penicillin, we may need to monitor their kidney function in I's and O's, get a baseline EKG, and monitor for any allergies. If they're taking it PO, they should take it with meals. If a patient's receiving vancomycin, they're going to need vancomycin TRO levels and monitoring throughout their treatment. As far as antibiotics go on a whole, we want to educate our patients to take the entire course. If the patient does not take the entire course of their antibiotic, it increases the risk of them becoming reinfected, and it also increases the risk of forming a multi-drug resistant organism. So then we have our antibiotics that affect protein synthesis. This includes our tetracyclines, such as tetracycline and doxycycline, our macrolides, which include erythromycin and azithromycin. So you can see that they end in myosin with the tetracyclines ending in cycline. And then we have our aminoglycosides like gentamicin, neomycin, and any medication that ends in mycin. Indications of tetracyclines is it can be used to treat dental infections, acne, infections of the GI system, respiratory system, reproductive system, and cardiac systems. For macrolides, it can be used to treat rheumatic fever, Legionnaire's disease, pertussis, diphtheria, and chlamydia. And then our aminoglycosides can be used to treat E. coli, intestinal tapeworm infections, and tuberculosis. The mechanism of action for tetracycline is that they are bacteriostatic. So what this means is it prevents protein synthesis and therefore growth. Our macrolides are also bacteriostatic, but if given at a high enough dose, it becomes bactericidal, which means that it kills the bacteria. And then aminoglycosides also disrupt protein synthesis, but they are bactericidal. And these can be given IV or PO. As far as side effects go with tetracyclines, we can see cramping, nausea and vomiting, diarrhea, esophageal ulcerations. So we would want to educate them to be upright for a few hours after receiving the medication. It can cause tooth decay, photosensitivity. So we would want to educate them to use SPF 30 or plus and wear sunglasses. It can cause superinfection, dizziness and lightheadedness, and more severely, it can interact with hormonal contraceptives and antacids. So if a patient's getting an antacid and a tetracycline, they would need to take the antacid either 1 hour before the tetracycline or 1 hour after or 2 hours before. It can also interact with digoxin, which can increase dig toxicity. It is contraindicated in those that are pregnant, in children younger than 8, and those with liver and kidney disease. We can have them take a tetracycline with food if needed. For our macrolides, it can cause GI discomfort and prolonged QT intervals, and more severely ototoxicity, which would include hearing loss, vertigo, and tinnitus. Macrolides also interact with hormonal contraceptives, so we would want to educate them to use another form of birth control. It can interact with antihistamines, theophylline, carbamazepine, warfarin, digoxin, veramipil, cardizem, and antifungals. It is contraindicated in anyone that has a cardiac arrhythmia or liver disease. And then lastly, it may be taken with pregnancy. We would need to monitor their PTT and INR because with that interaction with warfarin, it can lead to bleeding. We would want to monitor their liver function, and if possible, we'd want them to take it on an empty stomach. If they have too much GI discomfort, they can take it with food, but it can limit the effectiveness. Then lastly, we have our aminoglycosides, which can cause neuropathy and optic nerve dysfunction, and more severely, that ototoxicity that we also see with the macrolides, nephrotoxicity, and hypersensitivity. Interactions is with penicillins and loop diuretics. If taken with a loop diuretic, it can further the risk of ototoxicity. It is contraindicated in pregnancy, kidney disease, anyone with hearing loss, and anyone that has had myasthenia gravis. One form of education that may be necessary is if a patient is taking an aminoglycoside, they may have to have immunoglycoside levels drawn through their blood work. And that wraps up our discussion on antibiotics.